Welcome to the second segment of Lining Up the Shot, a 5-part series of short videos to help health center staff implement the standards for adult immunization practice. Presented to you by the National Association of Community Health Centers. Today, we are going to explore the first standard, assess. The components of assessing patient needs are 1. Stay informed. 2. Implement standing orders. 3. Set up a patient reminder system. 4. Use system reminders. 5. Assess the practice. To show us why assessing patient needs is the first step to ensure patients are fully protected against many preventable diseases, we'll be joined by our patient Rio, who is here to navigate the process. Assessing Rio's needs starts long before our patient even steps foot in the health center. So let's see what systems could be in place to make sure we are fully prepared to assess our health center patients' needs. First, we want to stay informed of the latest CDC recommendations for adult immunizations. These guidelines can often change, so be sure that all staff involved in the vaccination process know the latest updates. This includes our front office staff and medical assistants, nurses, pharmacy staff, and providers who have an important role in this process. We want to make sure our health center's protocols offer guidance for each CDC recommended vaccine and have been updated with the latest clinical guidelines. Updates can occur annually. Once staff are armed with the proper vaccination information, implement standing orders to make it as easy and fast as possible to vaccinate our patients. Reducing wait times and removing the need for a follow-up appointment lets us free up time for ourselves and our patients, dramatically increasing the likelihood that patients like Rio get all necessary vaccines. Keep in mind that while standing orders may streamline the workflow, they also remove provider approval, which serves to double-check patient eligibility. This means staff training and updated information is that much more important. Next, we can make sure Rio is informed when it's time for vaccines by setting up a patient reminder system. This keeps vaccines on our patients' radar and encourages them to stay up to date. Like all patients, Rio lives a busy life. The text reminder that flu season is back again was greatly appreciated. Even better, the text included a link to our health center's online appointment system, so Rio was able to quickly book a vaccination appointment. Rio's parents, on the other hand, aren't quite so technologically savvy. They missed the same text reminder. Thankfully, our health center has a pharmacist who calls patients that are due for pneumococcal vaccinations. They called Rio's parents and scheduled them both for pneumo and flu vaccines. It's valuable to consider the patient population you're trying to reach, so you can figure out what kind of reminder system works best for them and fits with the capacity of your health center. Now, let's consider how we can use system reminders to best assess our patients' needs at the health center. We can use settings within our health center's electronic health record to generate reminders to pop up on Rio's chart once they've checked in. These reminders let our staff know if Rio is due for a vaccination, so we can start that conversation. Sometimes eligibility requirements are more complex. In those cases, we can use additional tools, like the CDC's Pneumorex VaxAdvisor mobile app, to screen patients who may have underlying conditions or other factors that would make them eligible for certain vaccinations. Overall, we want to assess how our practice is doing and identify gaps in our immunization workflow. We can conduct chart audits or do a quick analysis of our electronic health record to make sure we are conducting all the right steps in our immunization workflow and are documenting them appropriately. We can see that some providers have done a great job at following up with reminders. Others, however, are not constantly communicating with patients about needed vaccinations. It may help to set up short discussions to pinpoint where in the workflow gaps exist, so more patients receive vaccine reminders. Looking at Rio's chart, it looks like Rio refused a COVID-19 vaccine that they were eligible for today. We know that sometimes patients will refuse vaccines, but by documenting the reason why, we can follow up next time they come in and perhaps change their mind. Vaccination takes time and team. Next up in the series, we'll discuss the standard, recommend, and see how we can connect with our patients to make sure they receive the protections they need. To learn more about improving your health center's adult immunization program and download additional resources, visit www.nachc.org.